CNS from a that autonomic or visceral sensory information is not perceived. Okay? So now we have the motor output to the effector. Right? Now the motor output to the effector is involuntary. But the main difference, okay, well that's one of the differences, but the principal difference structurally is that it's a 2-neuron chain. Okay? The first neuron extends from the CNS to the autonomic ganglion. These are preganglionic neurons. Okay? So their cell bodies are located somewhere in the CNS, and they extend out in synapse in the autonomic ganglion. The preganglionic neurons, whether they are sympathetic or parasympathetic, are always myelinated B fibers. The preganglionic neurons, no matter what, always use the neurotransmitter acetylcholine. Okay? The postganglionic neuron cell body is always located in the autonomic ganglion. Whether it be the sympathetic chain, the prevertebral ganglion, or a terminal ganglion, the postganglionic cell bodies are always located in the autonomic ganglion. The neuron extends to the effector. The postganglionic neuron anatomically is always an unmyelinated C fiber. It may release the neurotransmitter acetylcholine or norepinephrine, depending upon which division. So the postganglionic parasympathetics always release acetylcholine. Okay? The postganglionic sympathetics usually release norepinephrine. There's one exception, and that's postganglionic sympathetics to your sweat glands. They also release acetylcholine. So this is our basic organization. Okay? Now, we can now introduce in a picture form the two divisions. The parasympathetic division of the autonomic nervous system is called the craniosacral division because the cell bodies for the preganglionic neurons are located in the cranial nerves for 3, 7, 9, and 10, and the lateral horns of the sacral part of the cord, 2 through 4. And this is why it's called the craniosacral division, and that's why we always want to write down craniosacral, because that tells us where the cell bodies for the preganglionic parasympathetic neurons are located. Okay? Now, if we talk about the sympathetic portion, it's called the thoracolumbar, because the cell bodies for the preganglionic sympathetic neurons are located in the lateral horns of the thoracic cord and the first 2 to 3 lumbar segments, so thoracolumbar. Now, whether we're talking about preganglionic parasympathetic or preganglionic sympathetic, the neuron is always a myelinated B fiber. It always releases acetylcholine. It's always going to synapse in the autonomic ganglion. The postganglionic is always an unmyelinated C. It can release either acetylcholine, and it will release acetylcholine, we know, if it is a postganglionic parasympathetic. It will release norepinephrine if it's a postganglionic sympathetic, with the exception of postganglionic sympathetics to the sweat glands. Right, so now we've developed the two divisions of the preganglionic neuron. Okay, so preganglionic parasympathetic and preganglionic sympathetic. So now we want to identify the autonomic ganglion and the effectors. So all we're doing is just stratifying our second pictures. So we go over here. We do first the thoracolumbar. So this is the sympathetic division, right? So we already know the thoracolumbar division is telling us that the cell bodies for the preganglionic sympathetic neurons are located in the lateral horn of the thoracic and lumbar spine, specifically L1 through 12, or T1 through 12, and L1 through 2 or 3. Right? So here, this represents that. So the cell bodies are located here. Now, this preganglionic neuron extends and can synapse in the autonomic ganglion. These autonomic ganglion associated with the preganglionic sympathetic, this is the sympathetic chain. Right? Now, the major ganglion on the sympathetic chain include the superior cervical, middle cervical, inferior cervical, and the thoracic. Right? If the preganglionic sympathetic synapses in the superior, the postganglionic sympathetic is going to extend to the head or the heart. If the preganglionic sympathetic synapses in the middle, the postganglionic synapses in the heart. If the preganglionic sympathetic synapses in the inferior cervical, the postganglionic extends to the heart. If the preganglionic sympathetic synapse is in the thoracic, the postganglionic synapse is in the heart or the lungs. Okay, so now we've identified all the major sympathetic or autonomic ganglion of the sympathetic chain above the diaphragm and their effectors. Right now, again, we can apply that same information. This preganglionic sympathetic is a myelinated B fiber. It uses the neurotransmitter acetylcholine. Okay? The postganglionic is an unmyelinated C. It uses the neurotransmitter norepinephrine. Okay? Now, here this black line represents the diaphragm. Some preganglionic sympathetics pass through the sympathetic chain and synapse in ganglion that are next to the large arteries of the abdomen. These ganglion are called prevertebral ganglion. The three major prevertebral ganglion are the celiac, superior mesenteric, and inferior mesenteric. Now, if this preganglionic passes through, okay, and synapses in the celiac, this is called the greater splanchnic nerve. Okay? The preganglionics that will do that are extending from T5 to 9 or 10. Okay? If the preganglionic passes through the chain and goes to the superior mesenteric ganglion, the splanchnic nerve is called the lesser splanchnic nerve, and it's T10 through 11. Okay? If this preganglionic passes through and extends to the inferior mesenteric, it's going to be T12. It's called the least or lowest splanchnic nerve. Right? Now the effectors for the celiac, we have to remember all the organs that are here. Stomach, spleen, liver, gallbladder, pancreas. Okay? The lowest splanchnic goes to your small intestine and large intestine. Okay? The least, the least or lesser, the least or the lowest goes to the distal colon and then your bladder and your reproductive organs, which are in your pelvis. So here, again, we can apply the same information. We know the neurotransmitter released in the celiac ganglion is acetylcholine. The neurotransmitter used to stimulate the stomach, liver, always norepinephrine. So that's our sympathetic. Now, we do the craniosacral division. This is parasympathetic. The name tells us the preganglionic parasympathetic cell bodies are located in cranial nerves 3, 7, 9, and 10. And then in the lateral horn of 2 through 4. Right? So we start off with 3. Right? It extends to the ciliary ganglion. Right? The postganglionic parasympathetics extend to the eye. All postganglionic parasympathetics will use acetylcholine. Okay? So 7 goes to the pterygopalatine. Okay? The postganglionics extend to your tear, lacrimal gland, the palate, nasal mucosa. Okay? 7 also extends to the submandibular. Okay? The postganglionics extend to the sublingual and submandibular salivary glands. Okay? 9 extends to the otic, to the preganglionic synapse in the otic. The postganglionic extends to the parotid, which is your largest salivary gland. 10 goes to all of your abdominal viscera. So the preganglionic synapse at the organs, the postganglionic neuron is just really short, okay? Because these ganglion are right in the organ. Right, so all postganglionic parasympathetic stimulation to the abdominal viscera. Now, these ones from the sacral part of the cord form what we call our pelvic splanchnic nerves. Okay? Same thing, they're going to release acetylcholine. Okay? The postganglionics are unmyelinated Cs. They release acetylcholine. These are going to do parasympathetic stimulation to the pelvic viscera. Okay? So this is the basic organization of the autonomic nervous system. Now we've got to memorize these.